Good evening, everyone, and thank you so much for joining us. I can see people are just starting to sign in. We're about 2 minutes after, so I will go ahead and begin. My name is Carrie-Ann Bienz, and I'm the Associate Director of Graduate Admissions. And this evening, we are presenting a hot topic in healthcare, telehealth skills for the DNP family nurse practitioner. Again, my name is Carrie-Ann. Presenting with me this evening is Dr. Sherian Wilmot-Carter, and also with us on the panel is Dr. Linda Adams-Wendling. If you miss a portion of this recording or would like to share it with a friend or colleague, it is being recorded, and the recording will be sent out to attendees once it becomes available later on tonight. During the presentation, you may have some questions for Dr. Sherian, so please feel free to type them into the empty questions box, and we will be reading and answering them at the end of the presentation. So as you're thinking of them, please feel free to type them in so that you don't forget them. Okay, so I think that's all the housekeeping items for now. So I welcome Dr. Sherian Wilmot-Carter. Thank you so much for presenting to us this evening.
Hi, can everyone hear me?
Yes, thank you.
Awesome. So I'm Dr. Wilmot-Carter. I'm a track coordinator at Bay Path University. I also teach some didactic courses and also all clinical courses. I have been with Bay Path for just about 2 years now, and it has been an excellent experience. I have always been significantly impressed with how student-centered Bay Path has been. We do care for student success academically and also beyond the academic field, so once they transition into practice. So if you are viewing and you are not our students yet, we hope that you find this program very suited for your personal needs. Again, today I will go through hot topics in healthcare and particularly telehealth and how as nurse practitioners we can transition into a telehealth role successfully. I am going to go through the slides and I have an agenda here. I will still be speaking to you, but I'm going to go ahead and turn the camera off. Okay, can you still hear me? Can everyone hear me?
Yes, I can hear you. Yep.
Okay, beautiful. All right, so today we will begin with discussing the role of the DNP, FNP, and telehealth, essential telehealth skills, legal and ethical considerations as it relates to telehealth, telehealth visits best practices, patient engagement strategies, and then we'll go through a brief case study as it relates to a telehealth visit, so seeing someone virtually, and this will particularly cover a diabetic patient. Then we will discuss the challenges and solutions to some telehealth barriers that we may have, and then telehealth training and continuing education that is necessary not only for nurse practitioners, but also for any provider that is providing services to our patients via virtual. Okay, so first we will begin with discussing what is telehealth and the DNP's role in telehealth. So telehealth is simply the delivery of healthcare services remotely using technology. So most of you may have been in a situation before where you have had a telehealth visit, which means you have spoken with a provider for whatever services. Oftentimes this can be primary care services, this can also be mental health services such as counseling, but this is a visit where you would speak with someone using technology, so a computer oftentimes, a microphone, and also that face-to-face via virtual where you discuss your concerns and that provider offers a treatment plan for you. So that is simply what telehealth means, bringing healthcare to the patient's home or to the patient's environment, and it allows for so much more convenience as it relates to access to care. So the DNP has a significant role in telehealth, and just like any provider that is providing these services, we share very similar roles. So with the DNP, conducting virtual patient assessment is very important. There's a lot that ties into it that the nurse practitioner has such a significant role in. There's diagnosing and treating. So just like you would see a patient in office, you would triage that patient, diagnose and treat that patient. That same thing we can do virtually, and in the same breath, do it just as adequately as we would do it in office. And later on, I will discuss with you how we would take those steps in getting that done adequately and appropriately. The other thing that's important with telehealth as it relates to the DNP role is patient education and counseling. Again, we're transitioning from that in-office visit and still providing patient with education and counseling towards their, whether it's an acute disease or it's a chronic disease, we can still offer counseling via virtual. Another important thing as it relates to telehealth visit is remote monitoring. Now, this is something that has been advanced over the years. So remote monitoring oftentimes takes into consideration vital signs, including blood pressures, heart rate, blood glucose levels. And there's a number of different devices that are available out there that allows for providers to access patients' vital signs remotely. There are also very, very common, you may have heard of them, is the blood sugar monitoring system, or CGM is oftentimes what they're called. And this is where the provider, whether this is a nurse practitioner, the physician, the endocrinologist, is able to download the patient's blood sugars for a particular period of time, so that way they can view it in office and get adequate, appropriate readings as to what this patient's blood sugars have been at home, in order to appropriately treat, adjust medications, and further allow for optimal health. So there's a number of remote monitoring devices that are available where patients' vital signs can be tracked in order to allow for an adequate telehealth visit. Collaboration with the healthcare team is also something that can be done via virtual. Again, there are a lot of systems that are used where you can add a provider. So for instance, if you are discussing a visit with a patient who just recently had bariatric surgery and may possibly be having a follow-up visit just to see how things are going with their health, you can add a nutritionist to that visit by adding that person virtually to the call, so that way that nutritionist can also give that patient some advice. You don't necessarily always have to collaborate with another healthcare provider at the same time as the call with the patient, but once you have seen that patient, that consult note, you can also share with other providers who are involved in this patient's care. Another important role for the DNP is allowing access via telehealth to rural and underserved populations. And one of the things that's important is these patients oftentimes are in a situation where there's multiple barriers towards access to care. This can include transportation, finances, just a number of reasons. And so telehealth offers them, again, that in-office care right in their own homes. And so you might think, well, if they're in a rural area, if they're in an underserved area, we might also encounter barriers where we may not be able to see them telehealth because they may not have Wi-Fi services, they may not have a computer. But virtual visits can also be offered to patients, or telehealth visits can also be offered to patients via a phone call visit. So you may not necessarily have to physically see that patient in office or face-to-face via virtual. You can also do a phone call visit with this patient, and it still qualifies as a telehealth visit. So again, you're bringing access to patients. The other thing that is to be considered is, in your rural and underserved population or areas, this patient might not have access to these services in home, but maybe they have access to a public library that has a room that is private enough for them to have a visit. So there's a number of things as nurse practitioners and providers, we do have to think outside of the box in order to get services to patients who aren't able to come to the office, because at the end of the day, the ultimate goal is for their health to be at most optimal by whatever means necessary, as long as it's within safety of the patient. So a number of different things that we would consider. The other thing that's important is advocacy and policy involvement. So FNPs may advocate for telehealth policy change to expand access and reimbursement. And so getting involved with the financial side of billing, the financial side of the organization, finding out what better ways can I advocate for a certain policy change in order for us to allow more access to patients at home. It's also important for providers and nurse practitioners to stay up to date with telehealth regulations and guidelines, because we have to ensure that we are in compliance and we're providing the most optimal quality of care to our patients. In order to do this, we do have to abide by these rules, abide by these policies. Particularly, these are set forth by the insurances. So we must ensure that we're following these rules and regulations in order to adequately serve our patients. So moving on to some telehealth statistics, right? So as many of you may know, telehealth has existed for a number of years. It has existed for over the last 20 years. It, however, has grown significantly. So the chart on the left side of the screen that says telehealth market growth. So this shows telehealth services and how they have grown over the last 6 years, so between 2010 and 2016. So 2010 started out with $9.8 billion of telehealth services billed to insurance, or the telemedicine market. And in 2016, that almost tripled to 27.3 billion. Now, as you can imagine, 2024, those numbers have tripled even more. And that's because we all know COVID happened between late 2019 to 2020, and we still have COVID that we battle day by day. But that has increased telehealth services nationwide. And that's because, more importantly, at that time, we were trying to decrease the risk for transmission of this virus. But it has also opened the doors where a number of organizations have been very thoughtful that this has been more convenient for patients. There's been more access to care. Patients have been more compliant because it's been easier to get treatment. And so these numbers will continue to grow over the next several years. So though the ultimate start of this boom was a negative, we look at COVID-19 as a negative, there's a lot that we learn from this in healthcare, because we learn to better our services, we learn to reach patients farther and farther from our common areas. So again, telehealth has grown significantly. Particularly in 2021, there was 37% of adults that were using telehealth services, and that was just over a 1-month period. So that was that first year post-COVID. We have also seen that these services have increased with age, and women particularly have had a higher need for telehealth services, or have sought out telehealth services more than men. So we've had, between 2021, a percentage of 42% women seeking telehealth services compared to 31% males seeking telehealth services. And these may be for a number of different reasons. One of the common things that came up in research was patients who were pregnant or trying to get pregnant, and in the midst of COVID, having much difficulties finding a provider, getting into the office to get ultrasounds done. So a lot of women were seeking avenues where they could get these services done telehealth. And so that's why there was more of a spike for women than it was for men. So very, very interesting statistics on telehealth. And again, as you can imagine, this is not something that's going to go away. It shall continue to grow. And as providers, we will learn to be better at telehealth services, we will learn to allow even more access to our patients as we advance. And so we look at the essential skills of telehealth. And this, again, more so for nurse practitioners, but for anyone providing services to patients via telehealth, one of the most important things to be familiar with is technology. So the proficiency in technology. So the simplest thing that's necessary is a computer or a cell phone. So we know that's a must. Same for the person providing the services, and then for the patients who will be awarded those services. So it's important to understand telehealth platforms. Basic troubleshooting is significantly important prior to starting your visit. So one of the things that we typically recommend, if you have a patient that has never done any telehealth visit previously, it's highly recommended to provide them some education on how this visit will play out. So there's a number of different services or platforms that are used. For instance, Doxime, and then there's another service called Doximity. So there's a number of platforms. You also have to educate the patient on how they will receive that information. So for instance, with Doximity, whenever this patient is going to have a telehealth visit, you simply use this patient's telephone number, and you have to educate them that a text message will come to your phone. So this has to be a cell phone. It cannot be a landline. And so once we send that text message to your phone, there will be a link that allows us to connect. Oftentimes when I use the services with my patient, I always tell the patient, you do not have to download any app. This is not a downloadable platform, because sometimes just with a lot of issues that we have with technology and patients getting hacked, we oftentimes give them instructions so that way they know how this again should play out. So if there's any diversion in the protocol, then they're well familiar with something must be wrong, let me contact the office to make sure everything's okay. The other important thing as it relates to telehealth services is ensuring that whatever platform you are using to provide these services is HIPAA compliant. Insurances will check for these, and it will affect reimbursement through insurances if these platforms aren't HIPAA compliant. Now, as a nurse practitioner, this is not necessarily our first responsibility. This is the responsibility of the organization to ensure we're using a system that's adequate, but it's certainly something that we should be aware of. The next thing that's important is an essential telehealth skill is effective communication. As you can imagine, you may have possibly had telehealth services before, or even, for instance, a webinar, and you have difficult time hearing the presenter. You may have a difficult time seeing the presenter. So there's a number of barriers as it relates to communication. And so you must understand patients that you'll be seeing will vary from all ages. And so you do have to adjust your communication skills to make sure information is being broadcast to your patients adequately, especially your elderly patients who may have a difficult time accessing this kind of technology or maneuvering around it. So adequate communication is very important. You have to be clear, you have to be empathetic. Most importantly, you have to also listen to the patient. Oftentimes, I would recommend whenever you're doing a visit and you are actively listening to a patient, occasionally move. So you can sway, you can move your hand, you can move your head, just so that patient know you're still there. Because again, we're using technology, and technology sometimes fail, and you don't want the patient to think that you have frozen. Because I've been in situations before where the patient says, "Are you there? I can't hear you," or "I can't see that you're moving." And especially again, dealing with elderly patients. So it's recommended to occasionally have very subtle movement so that patient realizes that you are actively there. And then as it relates to clinical decision making, that's significantly important in telehealth. It becomes a little bit more difficult because you're limited with the amount of assessment that you can do. So assessing and diagnosing remotely is important for nurse practitioners to grasp, knowing when to refer for an in-person visit. So if there are limitations and you're not able to fully assess this patient via telehealth, then you need to know when to refer this patient for an in-person visit. or an in-person, an urgent care visit or an emergency room visit. So though you are not able to adequately assess because the patient isn't in front of you where you can touch, feel, listen, you do have to understand how to use other senses to adequately assess this patient. And we'll go into this further in just a little bit. The other thing that's important with clinical decision making is prescribing. So again, prescribing doesn't change whether it's being done virtually or in office. The most important thing is making sure you are providing an adequate diagnosis and a treatment plan for the patient. The world we live in now is so technologically advanced that most prescriptions are done electronically. And so whether you are doing that in office or via virtual, those prescriptions can still be sent for the patient. And then moving forward, we're going to look at legal and ethical consideration. So as we mentioned earlier, it's very important to ensure you are using a system that's HIPAA compliant. Also, as the provider, it's also important for you to ensure that you are adequately identifying the patient via a virtual appointment. So you still use those important identifiers. You ensure you're asking the patient's name, patient's date of birth, whether there is a catchphrase that's in the patient's chart that's important for verification, but you still have to make sure you are maintaining compliance for the patient and also confidentiality. So safeguarding the patient is important, is also an important thing for nurse practitioner. One of the things that happens is telehealth services can be done in a number of different remote locations. So whether you are seeing patients in clinic and you might have telehealth visits in between, or you're in the comfort of your own home doing telehealth visits, you still have to make sure that the platform that you're using is HIPAA compliant. You have to ensure that patient's information is kept confidential. You have to be in an area where other people, whether it's family members in the home, don't have access to patient information, because then we would be breaking compliance. So safeguarding the patient's information is important. Another very important thing before you begin telehealth visit is to always ask the patient for their consent. So though you may have already set up this appointment for the patient and they're fully aware it's going to be telehealth, you always want that patient to verbalize that they're giving their consent to proceed via virtual or a telehealth visit. The other important thing is to understand licensure and scope of practice. As it relates to telehealth, this will be a state-by-state requirement. Every state is very different as it relates to their roles for nurse practitioners, their licensure and scope of practice, and especially as it relates to telehealth visits. So understanding your state's regulation is important. Knowing what your licensing requirements for telehealth is important, and also your scope of practice limitations, if there is any, for telehealth. One that's very important, and this may not be across the state, but I can, the example I'll give to you is in Florida. So for nurse practitioners in Florida, there are certain insurances that will only allow for telehealth visits if these visits are done in the office with a physician, a supervising physician present. Some insurances will allow that to happen only if that physician is present. And there is, the way the templates are set up, there is a tab that will allow you to say supervising physician is present, and then you state that person's name. And if that information is not there whenever that biller, that auditor is submitting that claim, the insurance will certainly kick it back, because then that would be out of compliance. So you all have to make sure that you're following your state's protocol as it relates to what the requirements are for nurse practitioners and telehealth services. The other thing is important is informed consent. Again, before you start any telehealth visit, you always want to make sure you're getting consent from the patient. You want to also explain to the patient telehealth benefits and limitations. You want to explain to the patient the risks and confidentiality issues, and then documenting that consent appropriately. So remember, telehealth visits are not recorded. And so if you don't document it, no one will know that it was done or if it was said. So if you have asked that patient for consent and the patient has given their consent, you do have to document that patient has consented to telehealth visit via face-to-face or via video and audio. If this patient was just talking to you on a cell phone, then you will say patient has consent after you've identified who this patient is. You would then say patient has consent to proceed with telehealth visit via audio. So you have to ensure that informed consent is achieved. And then moving forward, we'll look at telehealth best practices. So it's important to get things prepared for your telehealth visit. Preparation is very important. You want to make sure before you see the patient, whether this is a patient you've seen multiple times before, just one time before, you want to review patient history. You want to ensure your technology is working, so do a number of tests before you start your visit with the patient, whether that's testing the microphone, testing the video. You want to establish a very quiet, private space. So again, if you're in your home, establish a space where you are not disturbed and there's no outside noise. You want to ensure that you're introducing yourself adequately to the patient and stating what your purpose is with the patient. So once you start to conduct your visit, it's most important to ensure that you have adequate eye contact with the patient. Make sure you're looking at the camera. Make sure, again, you're moving. So if that patient is talking and you're actively listening, occasionally make subtle movements so that that patient is able to see that the video has not frozen and you are listening to them. Whenever you do have any communication with the patient, especially things that are very important, one of the things that we learn is to always have the patient read back or to repeat what you've said. So always confirming the patient's understanding is very important, and making sure if the patient has questions, you're addressing all those questions. And then after your visit, you would think you're done with your telehealth visit with the patient, but another important step is to make sure you've documented this encounter adequately. You can arrange for follow-up if necessary. So before your visit's ended, you can say, okay, Ms. Brown, what I'm gonna do is I'm gonna schedule you for a 3-month visit. We're gonna do that next 3-month visit in office. My staff will call you and let you know what the date and the time is, and we will also mail you an appointment letter. So you always want to make sure you're establishing that common ground after you're done with your telehealth visit, so the patient is fully aware of what the next step is. Always provide the patient with resources and instructions. And so then we'll move on to patient engagement strategies. So there's a number of things that you can do to engage patients with telehealth visits. Another common situation is in a student situation. Whenever you're taking online courses, whenever you log into your course, it's always important for you to establish a number of things that engage you. So same for telehealth visits. We have to make sure we're engaging our patients, because we want them at the end of the day to understand the information that we've passed on to them, because our goal is to make sure they're getting the most adequate care, whether that's in office or via telehealth. So an important thing is education and empowerment. So we want to teach our patients how to use these telehealth tools. Again, if the patient has never used it before, you can offer them assistance prior to having that visit set up. You can involve family members. A lot of times, whether it's our elderly patients, they might have grandchildren that are around who's very technologically savvy. You can have them involved as long as the patient consents to have them involved. And again, this is just getting the patient set up with the telehealth service. Once the visit has begun, that person helping does not have to stay unless the patient is okay with it. So again, ensuring the patient is fully aware of how to use these telehealth tools, promoting self-care and management, and then offering resources for healthy living. So you're educating the patient, you're empowering the patient as it relates to their condition, whether it's mental health or a physical condition. The other important thing is cultural competence. So no matter where you are nationwide, you will run into barriers as it relates to cultural differences with patient or diversity. You always want to make sure, whether this is in office or via telehealth, you're respecting diverse beliefs and practices. You might have a patient that says, my beliefs, or based on my cultural beliefs or my practices, I can only see someone virtually after 10 a.m. or I can only speak to you via virtual over a telephone. So it only has to be audio. It cannot be visual, or it cannot be video if my spouse isn't here. It cannot be video if I don't have a family member here. So you always have to make sure you're explaining this to patients, so that way if they have a preference, you are abiding by those preferences. Language services are always available. So if you run into a barrier where patient speaks a different language and you need a translator, this is something that can also be set up via telehealth, where the language or the interpreter is present during the visit with consent for the patient, and of course consent from the organization, that you are able to have that interpreter translate for the patient. So ensure prior to getting these visits set up that language services, if needed, is available. You also, again, want to make sure you're tailoring care for the patient's preference. Ask the patient their preferences prior to starting the appointment, prior to setting up the appointment. Make sure you fully explain how a telehealth visit flows, so that if this patient is not comfortable with doing that, they can voice that concern and they can be scheduled in office. So always make sure you're being very transparent with the patient. And then building trust. It's so important to build trust with patients, especially via virtual, because sometimes they feel like that human concept or that human aspect is missing whenever they have a virtual visit. So you always have to ensure you're consistent with communicating with the patient, addressing all their concerns, be empathetic in all situations, again, especially for elderly patients. And I keep referencing our elderly patients because most of the time that's where you'll run into the barriers with not being able to use technology well. So ensure you're addressing all concerns and doing it promptly, and encouraging feedback. So ask the patient, okay, I realize, Mrs. Brown, that this was your first time doing a virtual visit. How do you feel it went? Are there any things you think I could improve on? Is there anything you think we could do better as it relates to the technology? Get the patient's feedback, because that's the only way you can improve the next visit, whether that's on an office basis or an organizational basis. But always encourage a patient's feedback, so that way we can do process improvement. Now we're going to go over a patient case as it relates to a diabetic patient that we're seeing virtually. And for anyone that is in a nurse practitioner program, or is even in a role as a provider where you do telehealth visit, this might be something that you run into oftentimes, where it's commonly thought, well, how am I going to do this visit with a patient over virtual? How am I going to assess this patient virtually? Well, I have a lot of pointers for you. So this case study, we're going to present Mr. John Smith. He's a 55-year-old male. His medical history includes type 2 diabetes and hypertension. His current medications, metformin, 1,000 milligrams, and he's taken that 2 times daily. That's what BID means. And he's also on lisinopril 20 milligram daily, and that's for his blood pressure. And so today we're going to conduct a visit with Mr. Smith. So Mr. Smith has gotten his telehealth video set up. He's able to see you. In preparation for that, as the provider, you have reviewed his history. You have reviewed his last set of labs, whether he had recent labs done or labs from previous, whether this is, say, 3 months ago. And so again, you've ensured that your platform is ready. You've done some testing with Mr. Smith. All right, Mr. Smith, before we begin, can you hear me? And this patient might verify, yes, I can hear you. Then you will go into your identifiers, having this patient say name and date of birth. You can also, if there is a catchphrase for this patient, you can verify that. But just as you would in clinic, you will make sure you're using adequate identifiers to make sure you're speaking with the right person. A common thing that I've seen in clinic, and especially with having precept, being a student, I have seen a lot of times with providers, they're so familiar with the patient, they know exactly what the patient looks like. They oftentimes forget to verify this patient's name and birth date. You always have to make sure that you're following this protocol, identifying patient's name and birth date. And one significantly important thing with this is, yes, I may know that this person is Mr. Smith. I know what he looks like. It hasn't changed. It is 100% him. One way that we can test virtually this patient's cognition is to check his memory. And so we ask him, can you tell me your name, your full name and your birth date? And if he's able to tell me that, whether I don't necessarily need it to identify who he is, I've just checked off my neurological assessment because now I know he remembered what his name and his birthday is, right? Or same for his medication. Can you tell me the name of the medications you're taking? If he's able to list those medications, one of two things I know he's done. He's remembered what his medication is, and we've done our medication reconciliation. He's verified which medications he's taken, and he's done it appropriately, and I know he's on the correct doses of medication. So try not to skip any steps, even though you might be very familiar with this patient. So once everything is ready on your end and also on the patient's end, you will begin again by introducing yourself. And I'm here to discuss diabetic management. You might ask him about what his blood sugars are. So this is where those remote monitoring devices would come in. Whether it's him having a blood pressure monitor and he's going to go ahead and in front of you go ahead and check his blood pressure, whether he has a O2 machine and he's going to check his oxygen saturation and his heart rate. So though you can have him check his vital signs actively while you wait on him, or you can have him check it before. If you know that this is a reliable patient, you can certainly have him check it before, or if you feel like there's some issues with reliance, you can certainly have him check it right away. For the blood sugar machines, one of two things. If this patient has a machine that they're able to download to the office, then you can pull up the blood sugar readings to know what they've been running. You also have access to the patient's lab so you can see what the A1C has been running. If this patient does not have a machine that is able to download to the office, then you can simply ask the patient what your blood sugars have been running. They will pull it up on their Freestyle Libre or their Dexcom and they're able to tell you. Or whether they're doing finger sticks at home, you always want to make sure a patient is logging those blood sugars. And so you will be able to see what those blood sugars are running. So you've already checked off his cognition, you've already checked off his memory, you've already identified what his blood sugars have been running. You can also ask him about his diet. What did you eat for breakfast this morning? What did you eat for lunch? Just depending on the time of the day that you had the visit. Did you get any exercise today? Did you get any exercise yesterday? So having this flowing conversation is still bringing out a lot of information that would be important to ultimately develop your treatment plan. And these things you would do just the same if you were in clinic. So you're still achieving those goals via telehealth. You also want to make sure you're checking that the patient is adhering to all therapy. Always want to address the patient's concern. So after you've triaged the patient, you've talked to the patient about their concerns, then you want to move into a physical assessment. And this is where most people have major barriers as it relates to telehealth and physical assessment, because we think, well, how am I going to do a physical assessment on a patient if they're not physically here, right? I can't touch them, I can't listen to their heart, I can't listen to their lungs. Well, this is where we're going to use our other senses, right? So we may not physically be able to touch them, but we can always have the patient ask the patient for help, right? And it's a matter of how you're documenting it. We cannot listen to them with our stethoscope, but if our microphone is working well, we can certainly hear if this patient has audible wheezes, or you can see the patient to see if this patient is using accessory muscles, or if the patient is having labored breathing. So there's a number of things that you can do to assess the patient where you're still gathering your information, whether this patient is in office or not in office. So it's very important to go through each system. Same for heart. You ask the patient, have you been having any palpitations? You certainly can't listen to the patient's heart, but obviously if you are hearing any heart sound, any S3, S4 via virtual, we have a big problem. Those are very audible sounds to be hearing it via virtual, and typically that means there is some impending doom. So if you are hearing any patient's heart sound via virtual, that's certainly a concern. Again, audible wheezes. If patient is a patient who has COPD or asthma and you're hearing audible wheezes, then we know you might need to make some adjustments. Then you might need to ask the patient, have you been using your inhaler, or did you recently have a cold? Obviously, we can see the eyes to see if they're injected. We can see if they're watery, so you can know if the patient might be having some allergy reaction or just seasonal allergy. You can hear the patient if the patient is coughing. You can hear if that cough is dry or if that cough is wet. You see the patient, so you can see if the patient looks disheveled. You can see if the patient looks withdrawn. You can see if the patient looks sad, depressed. You can see if the patient is anxious. Again, there's a number of things that you can see, that you can hear, that still allows you to adequately do an assessment. Another thing that's important, I've actually caught this with a virtual patient of mine, is jaundice. I've had the patient pull their eyes down. If I know that this patient has a history of liver disease, or for instance, a history of alcohol overuse, then I'll have the patient pull their eyelid down. All right, Mr. Smith, I want you to pull your eyelid down so I can take a look in your eyes. Try to get it as close to the camera as possible. And what I'm looking for is to see if the white of your eye is yellow, and this would mean so on, so on, so on. So don't just do an assessment and not inform the patient what you're doing, because the patient wants to be involved. Again, we're doing this virtually, so we want it to be as empathetic and patient-centered as possible. So get the patient involved in their care. Have the patient run their hands through their hair. If this patient has a lot of dermatitis, oftentimes you can see those flakes. So there's a number of ways that we can manipulate a physical assessment virtually, so we're still getting adequate information to document it. And if for any reason there's information that you need that you're not able to get via virtual, then that would be the time you will explain to the patient, for these reasons, I'm going to schedule you for an office visit at this time, so that way I can adequately listen to your lungs. I heard some audible wheezes. I know you're using your inhaler adequately, but I just want to make sure that these symptoms don't worsen. So I'm going to have you come into the office at this or that time, so that way I can adequately listen to your lungs. Okay? So we've gone through our assessment with the patient. We know what his vital signs are. We know what his blood sugars are. We know what medication he's on. And this allows us to now come up with a treatment plan for the patient. So we can decide, do we need to make adjustments based on what his blood sugars are? Do we need to make adjustments to his blood pressure medication based on what his blood pressures have been running? And we always know, especially as nurses and in healthcare, that the most accurate blood pressure comes from the patient at home. That's their most relaxed environment. Their blood pressure is typically more adequate or accurate there. So we've gotten our vital signs. We can adequately come up with a plan for the patient. And so we share that plan with the patient. Okay, Mr. Brown, this is Mr. Smith, this is what the plan is. Your A1C from the labs that you just did is 6.9. That is very adequate for your age. The last time we did your A1C 3 months ago, it was at 8.2. So we do believe that this regimen is working. There's no need to change it because we're seeing improvements in your blood sugar. I still recommend that you eat healthy, and these are the things, you can list the things out that you want the patient to abide by. So I still recommend that you eat healthy and try to get as much exercise. And this would be a moment for education. You explain to the patient what regimen of exercise you would like for him to get on based on his age. So we don't need to make any adjustments to his diabetic medication, but if we did, this is still instructions that we could give the patient. Let's say the patient's A1C was higher, and we said, well, we're going to add a medication daily. It's called Ribelsis. We're going to add 1 tablet daily. You will still take your metformin twice a day, but this medication I'm going to add in addition to the metformin, so that way we can achieve more adequate control of your A1C. And then this allows you to provide this patient with education about this new medication that they will be on. And so the patient might say, well, how am I going to get the information about the medication? I'm usually in office and you give me these papers. One of 3 things. A lot of platforms have a portal where the patient, you can send this information to the patient via portal. You can also put a note on this patient's prescription to the pharmacy. Please ensure that you provide these instructions to the patient, or you can have it mailed to the patient. So there's a number of different ways that you can maneuver around that. So we've seen the patient, we've triaged the patient, we've gathered our information, we've done our assessment virtually, we've made adjustments to our medications, and we've adequately educated the patient. We've completed our telehealth visit. So now we tell Mr. Smith, All right, Mr. Smith, this is the end of our visit for today. I'm going to schedule your next appointment at this time, at that time, for these reasons. The next time I would love to see you in office so that way I can get a more adequate listen to your lungs, so that way I can listen to your heart more adequately, and that way I can check your A1C in office the next time rather than have you go to the lab. So always providing this information to the patient, and you always want to leave the patient with if there's any concerns, any questions, if you encounter any difficulties with your medication, please feel free to call the office or have your family member call, have your wife call, have your sister or your brother call, whoever is on that HIPAA list, okay? So we've fully done a telehealth visit for a diabetic and a hypertensive patient adequately. So now our goal as the nurse practitioner is our post-visit documentation. We want to make sure we adequately put on paper what we went through with the patient. So again, most important thing is your consent, your identifiers. Again, whenever you document your assessment, there's a number of different things you won't be able to assess. So you would just put a note to say, visit done by a telehealth or a visit done by a virtual, unable to assess. Visit done via virtual, unable to assess. And then the areas that you were able to assess, then you document. For instance, lungs. Visit done via telehealth, was not able to use stethoscope for assessment. However, no audible wheezes heard. No use of accessory muscles seen. No labored breathing seen. So you're still able to document these findings where insurance will adequately look through your note and see, okay, this was an adequate visit done. I accept this claim. This was appropriate. This falls in line with my regulations, okay? So we've fully done a telehealth visit with Mr. Smith, and we've scheduled him for his next appointment, okay? So now we will move on to challenges and solutions. So as you can imagine, there are a number of challenges that we will encounter with telehealth. Most important thing is technology barriers, so lack of access to device or internet. But again, remember, a solution that we could use is there's alternatives to communication. If the patient doesn't have Wi-Fi or connected internet, then we can do phone calls. We can text the patient over their portal, so make sure you're using an appropriate medical platform that the organization allows. So if we don't have internet access, or if the patient doesn't have internet access, there are alternatives to still having a conversation with the patient or having a visit with the patient virtually. The other thing is reimbursement and insurance. This is such an important thing to know. There are a lot of insurances that will allow certain visits to be done via telehealth, and then there's some insurances that will not. You need to know what your state regulations are, because this is how you will be able to bill these insurances virtual visits and for them to reimburse the organization. So for instance, in Florida, insurances, or Medicare particularly, will allow a Medicare annual visit via virtual as long as the provider is able to see that patient, check their blood pressure, their temperature, and it has to be all the vital signs. If there are any labs, you have to address those labs. If the patient has any screenings, you still have to make sure you're going over those screenings. But the most important thing with Medicare is to ensure those vital signs are documented, and the date is the date of the visit. If those vital signs are not documented, Medicare will not reimburse. And then there are some insurances that will not reimburse telehealth visit for annual. So for instance, in Florida, Blue Cross Blue Shield will not allow an annual visit via telehealth. And they have different rules and different policies as to why they feel these things need to be done in office. So for instance, this insurance might say, well, this is the one time a year I allow this annual or this visit to be free. So I do want this patient to be in office to get a full head to toe where you're listening, touching, feeling. So some insurances, again, will allow it, some insurances won't. You do have to find out what your policies is, because they will vary across the board. Most important thing, solution to this, is to stay informed. Make sure you are aware of when these changes are, and ensure you're advocating for your patients. The way Medicare actually changed those rules is with providers advocating for that. There's a number of elderly patients who weren't able to come into the office, and so providers found better ways where we could do that annual visit virtually that Medicare felt like was acceptable enough in order to allow it. So you do have to advocate for your patients. And then privacy concerns. There's always privacy concerns, especially on the patient's side of things. Some patients are very reluctant to share information, especially if you're meeting them for the first time. So one of the solutions to this is to ensure that you are emphasizing the security measures. Explain to them the technology that you're using. Explain to them, even though I am at home, and I'll say one thing with that, the patient will only know if you're at home if you tell the patient you are at home. One of the reasons why most organizations will have a policy against or ensure that you're using an organizational background is for those reasons. One, you don't want any identifiers in your background that says you are at home. But it is okay to tell the patient that you are at home, but ensure you're telling the patient, I am using a organizational organization issued laptop. I am using a platform that the organization allows. It is compliant with HIPAA. We ensure your confidentiality. So emphasize these security measures so that way this can build trust with the patient and they're able to confide in you and open up about the concerns that they're having from a medical standpoint. So always remember to address that with your patients. And then moving on to training and continued education. So again, the world that we live in, most people are very familiar with technology. However, the telehealth platforms can be very different. So we always ensure you go to workshops, telehealth workshops, learn different platforms. Some organizations use more than one telehealth platforms. Make sure you are familiar with all the platforms that are presented. So if for some reason you have to use one or the other, you're well versed on it. Always ensure that you take legal and ethical courses. These courses oftentimes can be specific to telehealth or specific to healthcare, but you also have to ensure you are taking courses that are specific to the state that you are practicing in, the state that you are treating patients in, because state regulations is most important. And then of course, continuing education on virtual care. And this is where you would get involved in CEUs that allows you to better improve your assessment skills as it relates to doing a head-to-toe telehealth visit, how you would document it, how you would ensure that all your information is documented in the patient's chart, or all information that's needed is gathered from the patient to adequately and accurately diagnose and treat your patient. And I thank you all for listening. Any questions?
Thank you so much. Let's see. I am going to just pause and give people a moment to type in their questions while I take a look here. The first question I'm seeing come through, Dr. Wilmot, is you just spoke about training when it comes to telehealth. Is that at the practitioner's expense, or do you find that employers will reimburse for that?
So that's a great question. So most employers, if not all, will reimburse for any training that is appropriate to the organization or your function in the organization. One of the things that's important to you, whether you're already practicing or once you get into practice, is your contract will oftentimes include CME, which is monies that are given to you as the provider to ensure you're doing continuing education. And most of the organizations or facilities, they won't necessarily tell you what CEUs you need to do, but this is where you need to be proactive in improving skills that you think you might need some improvement on. So for instance, if it's telehealth and there's a webinar or there is some online courses that are available, then you can take those courses and then present that certificate to your organization so that way you can be reimbursed from your CEU funds or your CME funds.
Great, thank you. And let's see, the second comment question I'm seeing come through is, I'm sure telehealth services have skyrocketed from the onset of COVID. Do you think that more programs either are or should incorporate kind of telehealth courses within their curriculum?
Absolutely. That's also a very good question. I absolutely think all programs that are not just for nurse practitioners, this could be for PAs, physicians, should include telehealth courses so that way students become familiar with the pace of telehealth, the protocols, different rules and regulations, and just simply to become familiar with how to get it done. That's one of the beauties with BayPath. If you're not already familiar with our program, we do offer a lot of telehealth services to our students through their clinical hours. So whenever we have students go through their different clinical rotations, we do have some of those hours that are counted via telehealth. So we get students set up with telehealth providers so that way they're familiar with how this plays out from a provider role, from a patient standpoint, how you can still do these assessments and still bill for them. So again, it's a part of our curriculum that we do allow these students to become very familiar with telehealth services so that once you transition into the real world, it's not new to you, you're able to transition smoothly. And most of the time, the only difference is you will need to learn the new platforms that those organizations might use, but the standard of how to conduct a telehealth visit would have already been established.
Great. And within your experience, do you find that a lot of the telehealth, I guess I'm may not be using the right word, but the telehealth CRMs, the systems, are they fairly the same, or are there different systems used? Or I guess kind of like some hospitals might use Epic, some for their CRM, or others. Is that the same for telehealth?
So it is. So if you're referencing the charting system, so your charting system is going to be the same that the organization is using. So whether that's Epic, Athena, Chronos, it will be the same platform that you will use for the telehealth visit. What's different is the actual tool or platform that you will use to see the patient. So oftentimes an organization will have a standard across the board. And so for instance, they might pay for a subscription to Doximity. And so all the providers must have Doximity downloaded on their phones. So that way when you will log in oftentimes with your organization's email, there's also a tab that you will choose your organization's telephone number. So that way, once that message goes over to the patient that their visit is ready, it populates, for instance, Berkshire Healthcare is ready for your visit, or Dr. Wilmot-Carter at Berkshire Healthcare is ready for your visit. So it's identifying that this is a visit from my primary care provider, my primary care's location. So the charting system will still be the same, whether that patient is in office or telehealth. It's the platform that you would download, whether on your cell phone or on the computer, that would be standard across the board that the organization chooses. I have not seen a situation where I've been in an organization where each provider has a different telehealth platform that they're using. Most of the time, the organization chooses that and is paying for it from a group rate, and each provider just has to download that platform. So if you're not familiar with it, it's something that they would provide training for.
Perfect. Thank you. Well, those are all the questions that I'm seeing for now. However, this is a lot of great, fantastic information. So if you are thinking on it tonight and say, oh man, I wish I asked this question, please feel free to email it to me, and I will connect you with Dr. Wilmot-Carter, and I'm sure she'd be happy to answer them for you as a follow-up. And let's see. So here's Dr. Wilmot's references for everything that she discussed today. And then just very quickly, I'd like to let folks listening know that we do offer nurse practitioner programs here at Bay Path University. So these are our graduate nursing programs. If you are interested in learning more about them specifically, please feel free to connect with me. Again, my contact information will be coming to you, and it's also on the next slide, but we do have a doctorate of nursing practice, so a DNP, where it has 2 entry points, so a BSN to DNP FNP, which is 70 credits comprised of 19 courses, and the post MSN to DNP is 36 credits with 12 courses. Both are completely online and asynchronous, so we know that our students are, first of all, from all over the country and are all working very different hours as nurses. So online and asynchronous, along with we do offer, if you weren't sure about obtaining your doctorate or wanted to earn your MSN first, we do have a completely online MSN with competencies in administration and education. Also 36 credits comprised of 12 courses and online. And this right here is mine and Dr. Adams-Wendling's contact information. Please feel free to reach out if you have any questions about the program or the application process. We are rolling admissions, so we are always accepting applications for the upcoming start. This program, both DNP and the MSN program start twice a year, once in September and once in January. And again, that concludes our presentation. Thank you so much for joining us, and thank you very much, Dr. Wilmot-Carter, for presenting for us this evening.
Absolutely, you're very welcome. Thank you all to everyone for joining.
Thank you so much. Bye.